guys, welcome back to our channel. This is Veronica, between two ferns and a candle. We're going to go ahead and do our vascular disease video number 2. So I'm going to be starting off with peripheral artery disease. And this is narrowing and decreased perfusion due to atherosclerosis. And so when we say peripherals, we mean the arteries outside of like the cardiovasculature, so like your legs, your arms. And the presentation that you're going to find, the biggest thing is going to be claudication, and that is going to be pain in your calves, and this usually occurs during exercise. That's when patients find this. And you're going to have heavy legs, and so the patient would describe that to you as having heavy legs. And then you also can find skin discoloration on those legs as well. And then as far as diagnosis, the best way to diagnose this is with the ankle brachial index, and so that's where you get the systolic blood pressure on the right and left arm, and then you take the highest number, and then you're also going to get the blood pressure on the right leg, and then you divide the highest number by the lower number, and that will give you the index. And a normal one is 0.9 and up to 1.2, and then if it's less than that, that's kind of where you start to have problems. The treatment for this ultimately is exercise, and so a lot of times patients will tell you that it's painful to exercise, but they really just want to push through it because that's going to be the best thing for them. Aside from that, you can also do stent revascularization. That's going to be kind of a later option aside from the exercise which you want to do initially. And so now we're going to go ahead and turn the time over to Shannon, and she's going to go over a few more things with us.
So today we're talking about another vascular problem, which is aortic dissection. Aortic dissection is not too hard because it has a couple big red flags that we'll go over. So to start off with, what is dissection? Dissection of any vessel, not only the aorta, is separation of the layers. So any vessel in our body has 3 layers, the intima, media, adventitia. So it's a separation of those. So if you see here, we have our 3 layers of the vessel. With aortic dissection, you get a tear in the intima. So what causes the dissection? So then blood can rush in, and then it goes through the stratified layers in the media, and then starts ripping the media away from the adventitia. So that's kind of the pathophys of the dissection. Signs and symptoms, so these are all classic aortic dissection, is a tearing chest pain. So in STEMIs, we get the crushing, elephant on my chest. This one's a little different, it's more of a tearing chest pain. And then you also can see asymmetrical blood pressures. So the way I remember this is aortic dissection, different blood pressures. So just remember the DI, because you might forget, which vascular problem has the different blood pressures. It's DI, different blood pressures, DI, dissection. So keep that in your head. And then another one is Horner syndrome. If you remember, PAM is horny, ptosis, anhidrosis, or ptosis, anisocoria, and meiosis. So anisocoria, different pupil sizes. So if you see different pupil sizes and the asymmetrical blood pressure plus tearing chest pain, you probably have a high clinical suspicion of aortic dissection. Diagnosis is going to be EKG and imaging. It wasn't too specific on what type of imaging, so that is provider discretion for dissection. And then treatment is going to be depending on the location of the dissection. So we have Stanford type A and Stanford type B. Stanford type A is going to be an ascending dissection, and then Stanford type B is going to be anything after the ascending aorta. So for type A, that is a surgical emergency, and then for type B, you can treat with medication therapy, and if that works good. If not, then you need to go and do surgery. So what the surgery looks like is essentially kind of, you can either cut out that area of the vasculature that has the dissection, or you can just go in and kind of try to clot it so that you don't have any more problems there. So that is aortic dissection. Thanks for tuning in.